And good afternoon, everyone. Thanks so much for joining us on this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry Demings will discuss some good news regarding the vaccine and introduce 3 students who are here today. More on them in a moment. The mayor will discuss those individuals, and the mayor will discuss other individual things regarding to the vaccination, including our work with Bravo Supermarkets, the Orange County Convention Center, and more. The mayor will also discuss our testing numbers and results from yesterday's 407 day. Orlando Mayor Buddy Dyer is also here to discuss progress combating the virus in the city of Orlando. Dr. Pino from the Florida Department of Health is also here to discuss important details regarding infection rates and state vaccinations. Last and certainly not least, Comptroller Phil Diamond is here also to discuss tourist development tax revenue. Much to discuss today. We will begin with the mayor, but just reporters with so much to discuss, what am I going to ask you? One question only, please, when we get to the press portion of this event. I'm glad you're with me. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you for being here. This is the 124th coronavirus update that we have provided from these chambers. We are in a race against time to get as many people vaccinated as possible as the coronavirus continues to spread. We have some good news that we will be sharing with you today. The latest Department of Health figures show that nearly 1 in 4 of Orange County residents have had at least one shot. We're at 24.5% of our population that has received at least one shot of the COVID-19 vaccine. For those 65 and older, Dr. Pino tells me that we're at 76%. 3/4 of our population have had at least one shot who are 65 and older. That is very encouraging as we look to get more people inoculated within our community. But right now, we're especially focused on our young people, and we have several who have joined us today. We want to ensure that we get more of our youth, our young adults, vaccinated within our community. 4 students representing the University of Central Florida, Rollins College, Valencia College, and Winter Park High School are here to get vaccinated today. They're going to do that before your very eyes in just a few moments. I'll be introducing them. They are highlighting the importance of the age group of 18 to 25-year-olds getting the vaccine. Dr. Prince with the Florida Department of Health will vaccinate these young people following the news briefing and our question and answer segment this afternoon. Again, our goal is to get the vaccine into the arms of as many diverse residents as possible, from those who are young to those who may be a little older or the most vulnerable in our community. And now, a news flash. To that end, starting Monday, April the 12th, we will take the vaccine into key areas in our community and neighborhoods by launching our very own Orange County-run COVID-19 mobile vaccination program. We're thankful to the partnership that we do have with the Florida Department of Health in Orange County, and these mobile sites will be the first time Orange County has had full control of the location and the vaccine allocation. We are fortunate to use this opportunity to better serve our minority and underserved populations in terms of access to the COVID-19 vaccine. I'm working with the emergency management staff to identify strategically selected locations of high need for COVID vaccinations in order to move the mobile sites around our county. Remember, Orange County is a 1,000 square mile county, so it's a big county. Our first mobile site will be at Barber Park on Gatlin Avenue in the Conway area. It will be able to handle 1,000 individuals a day. Barber Park will be a drive-through site that will operate from Monday, April the 12th through Friday the 16th between the hours of 9 a.m. and 7 p.m. Appointments are available and preferred between the hours of 9 a.m. to 5 p.m. However, there are limited walk-ups available between the hours of 5 p.m. and 7 p.m. if you are unable to get an appointment. You can go to our website at ocfl.net/vaccine for more information, as appointments will be made available online starting at 5 p.m. today. Future sites will be announced and posted as vaccine becomes available, so stay tuned to these press briefings. On Tuesday of this week, more than 13,400 appointments open for our convention center site. They were filled this time within 36 hours. Today, the convention center staff surpassed the 200,000 mark of individuals who have been vaccinated at the Orange County Convention Center. We want to keep our vaccination efforts going at an efficient pace to serve as many residents as possible. So if you can make an appointment, please do so. If you cannot attend after you've made an appointment, please remember to cancel the appointment to allow someone else to be able to take that spot. You can go to our website at ocfl.net/vaccine to sign up for alerts when appointments open up again, or follow Orange County government on social media. We are distributing now more than 4,000 vaccinations a day at the Orange County Convention Center. You heard earlier from Dr. Williamson that we do have a partnership now where we're going to continue to add vaccine opportunities to our webpage and at ocfl.net, including FEMA and state-supported sites. One opportunity I want to mention is a partnership with Bravo Supermarkets. Orange County government and the Florida Division of Emergency Management will host a vaccination event tomorrow at the Bravo Supermarket located at 4065 West Oak Ridge Road in Orlando. The event is free and open to Florida residents. The site will administer 400 Johnson & Johnson vaccines. So that's a site where it's one and done there. Interested residents are urged to arrive early as supply is limited. It is walk up only starting at 9 a.m. tomorrow. While we are excited about the distribution of vaccine, the coronavirus still is very much alive in our community. Since the start of the pandemic, there have been a reported 127,153 COVID-19 cases reported in Orange County. 1,206 residents, unfortunately, have died of the coronavirus. Our 14-day positivity rate has increased slightly to 6.6%. Today is Global Meetings Industry Day, a day of advocacy to bring attention to the value of meetings and events in our community. While virtual and hybrid meetings have gotten us through this pandemic, there's no replacement for face-to-face meetings. Meetings and conventions make a critical impact on our local community by generating millions in revenue and thousands of jobs for our residents. Across the nation, our community has served as the model on how to safely and successfully host in-person events, and it helped to restart our local economy. Because of this, the Convention Center has safely hosted more than 60 in-person events since the pandemic began to rage in our community, and another 81 booked now through the end of the year. We do recognize that all of those who helped make Orlando the #1 tourist destination for healthy meetings, and the impact on our local economy has been significant. And finally, I was proud to take part yesterday in the 407 day that happened. It was a partnership with Visit Orlando. We do have the CEO and president of Visit Orlando here, Ms. Cassandra Mate, who is here. Wave your hand there. She's relatively new to our area. We asked our residents to tag themselves for 407 Day, and here are a few of the folks who patronized some of the 6,000 restaurants that we have here in Central Florida. You can see the graphic behind me. We will continue to support our restaurant industry throughout the year as our community recovers from the pandemic. And now I'm going to turn it over to Mayor Buddy Dyer for additional comments. Mayor Dyer.
Thank you, Mayor Demings. And with vaccine eligibility opening up to everybody over the age of 16, it's available pretty much to everybody. And now it's time for us to do what we need to do. So my staff wrote up a bunch of notes about our shot, but I'm not feeling very Hamilton-esque, so I'm going to dispense with that and just suggest that now that it's your opportunity to be able to get vaccinated, it's incumbent upon you to do that, and not just for your own health and safety and the safety of your family, but it's the economically right thing to do for our community. If we want to bring meetings back, if we want to bring events back, if we want to return to some sense of normalcy, getting to herd immunity, which Dr. Pino will tell you is about 80% of our population being vaccinated, is important. So you can play a role in our community in helping us get back to normal. And we're headed in that direction. Here in Orlando, this last weekend, we successfully hosted the Spring Fiesta at Lake Eola. Orlando Shakes is performing at our Lake Eola, or Disney Amphitheater, right catty corner from here. The Front Yard Festival at Dr. Phillips Performing Arts Center continues to host events tonight, and the parking lot at the Plaza Live, there'll be a live concert there. We brought back our bowl games during the holiday season. We had Supercross, we had Monster Jam, but if we're going to continue on this trend of opening things up, we need to get vaccinated. So it's reassuring to see the arts and entertainment communities that have been so foregone for the last year being able to come back. At the Amway Center, we've announced 5 upcoming concerts. So a couple of these, if I mispronounce them, I apologize about that, but Banda MS, Kane Brown, Andre Bocelli, Eric Church, and Roger Waters. EDC is coming back to Tinkerfield. That will be in November. But we're working with all of the promoters and all of the different event coordinators to make sure that when we have these events, they're safe, they're secure, and people can come to those events without worrying about their health. So that means we're going to continue to wear masks. We're going to continue to socially distance as the CDC instructs us to do, and the health and safety of both the patrons, but also the artists and the athletes and the staff are important. I want to also mention 407 Day, which was started several years ago through social media efforts and then adopted by Visit Orlando and Orange County government. I had the opportunity to go to one of our fine breweries and see a 407 beer. It's also National Beer Day yesterday, as it turns out, so that was a very happy coincidence. But again, it's showing that we need to get vaccinated so we can do the things that we want to do. I want to recognize all of our small businesses that have had such a difficult time the last year, and we want to make sure that they are economically viable moving forward. And then lastly, I want to thank and commend our Orlando firefighters and Dr. Pino and his Department of Health staff. This week, our firefighters, in conjunction with the Health Department, have been out vaccinating people in their homes, those people that can't leave their homes to come to one of the vaccination sites. And that's not in the multiples of thousands, but it's a couple of hundred individuals that otherwise probably would not be able to get vaccinated without the help of the firefighters and the Health Department. So thank you. All right, Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. So both mayors have gone over some of the data, so I'm going to emphasize some points and add in other areas. As the mayor mentioned to you, we have accumulated 127,153 positive cases. Our recovery rate continued to be at 96%, and our positive rate for 14-day rolling average went a little bit up to 6.6. The number of deaths is up to 1,206. Our condolences with friends and family, of course. The age range from 31 to 85 years old, the median age 68. Those 8 additional deaths were 4 female, 4 male, 1 black, 1 of other, and 6 white. 4 were Hispanic, 4 were non-Hispanic. 5 has known underlying conditions. 3 we didn't know about any. 1 is from February, 5 are from March, and 2 are from April. 2 out of the 8 that were added, 25% of those were long-term care facility residents. For the variant cases, we have 17 new additional variant cases bring a total in our county that we know, and remember, it should be larger than this number, 159 that we know about it. The numbers are the B117, which people also know as the UK, is 143 of those, 15 new. The B1427, also known as California, 6 in total, 1 is new. The B1429, also known as California, 5 old cases. The South Africa, B1351, has 2 cases, and the P1, which is also known as Brazil, has 3 cases. 1 of those is new. The interesting thing about the number of cases, and I will show this data, I have it here, we will project it next time. I didn't have the time to send it. It is that the percentage of these infections that are due to variant in the youngest segment of the population is increasing when you compare to the wild variant, the more prevalent variant right now. So for example, in the age of 15 to 24, they are 17% of all cases from January 1st to April 7, but 24% of all those cases in that age group are from the variant. For people between 25 and 34, same time period, January 1st to April 7th, they are about 20% of all cases. But in that group, 25% of the cases are also of variant origin. So it continues to increase across age groups. For the vaccination information that we provide, several things. As the mayor indicated, our strategy on how to vaccinate and how to get vaccinated is switching a little bit. We announced these weeks ago, where you will go from main large mass distribution events to smaller places, multiple places out in the community, trying to find those pockets and areas that we have lower vaccination rates, and that's what will come next. Also with that, which is a good news and it's a sad news, on May 5th, we will give our last first shot of Pfizer at the convention center, because we are planning to close down that site by the end of May. Why are we closing the site? It's kind of punished by success, in the sense that reservation for events are increasing. They need a space, and the events that are coming as large, that it cannot accommodate both of us, and also just in time for the strategy to change a little bit. And so we are working on an exit strategy from the convention center, but I want our community to know that this is such an important asset in our community to have. And the employees there are such a great people to work with, that we cannot find the words to be thankful enough to the county for allowing this to happen, and for the convention center to hosting us the way that they have done it. These people go out of the way to find us power, electricity, sewage, water, anything that we need. They are really, really very, very accommodating. With regard to the vaccination, we have reached 200,000 at that site. And remember, when we first talked to you on December 26th, when we initiated vaccinations in our county, it was hard to imagine that we would have done at this point 200,000 vaccines. Doses administered in Orange County total, 518,579. Now, the numbers are going to be, I'm really under-reporting. I'm going to explain to you why. First, we still don't have access to the vaccine data that was done or continue to be done by the VA, because they report directly to the feds. We will get that data at some point. But also for Friday, last Friday and last Saturday, we don't have access to the data that was not done by the health department. Someone entered the letter N, the N that we have in Spanish with the thing on top, into one of the codes, and it corrupted the code because it didn't recognize. Now we know what the error was. We had to fix it, but they are trying to. So we are under-reporting probably by about, I would say, 20,000 in those 2 days. Orange County that have completed their series, this means first and second or Johnson & Johnson, 201,787. That is 15% of our population have completed all the vaccination schedule, and that is amazing. Now, residents with at least one dose, and the mayor mentioned to you, that is about 25% of our population, and that is counting those are not receiving vaccination yet, like younger than 16. Residents count on our county over 65 years old that have completed vaccination, 61.6%, and when you go 65 that at least have one or more doses are 75% of our residents in that group. I also want to mention to you specifically, why are we trying to increase vaccination in people younger than 18? Because those numbers are low for our county. Now, I know we started on Monday vaccinating these groups, but we want to go faster. So I want to encourage family and friends and students to get vaccinated. This data that I just showed to you, how the UK variants and other variants are becoming predominant and prevalent in our population, especially in the younger segment of the population, should be of concern, or at least be alert about this. People older than 18, doses administered under 18 in our county so far, only 1,189. County residents of those administered, only 1,100. Residents with serious completely under 18 is only 107. Of course, it's early for that, but that's 0.21% of the population in that age group. And residents who have received at least one or more doses under 18, only 996 in our county. That's only 1.95 of that segment of the population. So there is really an urgent need to increase those vaccination rates. As we come into new era of being vaccinated and the possibility of returning to some of our normal activities that we have done, it continues to be critical important to wash your hands, to wash your distance, and to keep your mask on. With that, Mayor, Controller Diamond, thank you.
Thank you, Dr. Pino. Before I talk about the TDT numbers, I just want to mention I got my second shot of the Pfizer vaccine on Monday. I've got my sticker on, and I just want to thank everybody that's involved in that process. I mean, it's incredible how they're getting 4,000 people a day through there. It was incredibly well run, and I just want to give thanks to the convention center and the county staff and the Department of Health and the firefighters, of course, and everybody else that's making that happen. And for anybody that's curious, no, I didn't really feel any side effects from my vaccination. So I'd sure encourage everybody to get out there and get a shot. Anyway, with that said, I want to announce the tourist development tax collections for February. They were $10,317,000. That is a 63% decrease from last February. However, it's a 34% increase from the month before, January, about a $2.6 million increase over January numbers. And that is very good news since the January collections were the first month-over-month decline that we had since the pandemic started. I would mention that even though the February numbers rebounded compared to January, it's still the lowest that we've collected in, it's less than we collected in any pre-pandemic February going back to 2004. As shown in the chart, we are still at, unfortunately, still at historic lows, although you can see the general trend is really good. We are heading in the right direction. And anybody that's been out to the tourist areas in March or on the roads around Florida in March saw a lot of tourism traffic. So hopefully that will continue in the months to come. Longer term, I think the CDC's updated guidance that people that have been fully vaccinated can now travel will be very helpful and especially important for Orange County because of the millions of people that have been fully vaccinated. So that should be very good for the numbers to come in the weeks and months to come. On the expenditure side, the county continues to use reserves to offset ongoing TDT collection shortfalls. However, this month showed the smallest drawdown of reserves since the pandemic started. In the month of February, reserves decreased by about $2.4 million, which, as I said, is the lowest since the pandemic started. To date, we've used about $131 million from reserves since April of 2020. Finally, we're going to have our March numbers sometime in early May, and with that, I'd be happy to take questions during the question and answer period. Thank you.
Okay, as we open it up for questions, just as a reminder, we have various individuals here to respond to questions. We're joined by Commissioner Gomez-Cordero, as well as Ms. Ilia Torres, who will assist if there's any Spanish-speaking media that needs translation. She's here. We also have Battalion Chief Renee Stone here if there are any questions about our homebound program. We have Mr. Mark Tester, our Executive Director from the Orange County Convention Center here. Also from Visit Orlando, you have Ms. Cassandra Mate, who is here looking for the school district representative. Oh, there he is. Scott Howard is here if there are any questions about the school district. And after we get through the Q&A, then I'll introduce our young adults who are here prior to them being vaccinated. So with that, I'm going to open it up for any questions of any of the speakers that you've heard so far.
Lauren Siebert, Channel 9, Mayor, my question's for you. I wanted to ask you about the criteria in choosing a location for the mobile unit. We've been pushing the state, Florida Department of Health, to give us the vaccination rates by zip code. And I'm wondering if you're using those vaccination rates by zip code to choose the locations, and if you would make that public.
Well, fortunately, the Florida Department of Health has given Dr. Yolanda Martinez, our department head for health services, access where she can view the data through the department's website. And so we are looking at the data that is made available to us as we begin to identify various zip codes and locations around the county where we believe that there are high socially vulnerable index scores and which is representative of minority communities and for the most part. And so we will strategically locate in those areas to try to encourage and improve the rate of vaccination within those demographics. So we don't, in other words, we don't keep the data. It's not our data, it's the Department of Health's data that we access.
Steve Hudak from the Orlando Sentinel. This question's for Mayor Dyer. Mayor, your office sent out a news release today about moving towards a greater reopening. I would hope that you could give us a little more explanation about why you're doing that. The one thing that concerns me from the data that we've heard is the slightly increasing 14-day rolling average. So I know that the opening isn't supposed to, this phase 3, I think it is like in June, so we have some time. But can you give me some of your logic?
So we had wanted to give our employees enough notice that they could come back to physical working space in a manner that allowed them to take care of any family situations they may have. So we are targeting June 1st to go to what we're calling our phase 3 reopening, and that means people will be back in City Hall. Now, realize that the vast majority of our city workforce has never worked virtually because they're firefighters, they're police officers, they're public works employees. So really, it only affects those who work in City Hall. But we think it's appropriate timing to do that. We'll give some flexibility to our department directors relating to whether there will continue to be virtual work by some of the workers, staggered schedules in terms of not everybody there at the same time. We're going to be doing some things in terms of socially distancing and how you walk around in the building, similar to the arrows that you see on the floor so that people aren't passing by each other. But we also think at that point there will be a significant amount of people who have been vaccinated, and we want to show the community how to come back in a safe manner. And it's in part supporting our business community that needs to be reopening their offices. So we want to be an example for that.
This is Melissa Thomas with Florida National News. This question is for Dr. Pino. So you'd mentioned earlier about that sort of inconvenience in terms of the little symbol causing a ripple effect in the reporting to the tune of about 20,000 being off a little bit. What do you guys normally do? First, is that the first time that's happened? And secondly, if it isn't, what do you guys normally do to kind of catch back up or offset that?
Yeah, and things are very technical sometimes, but so normally as a Department of Health, prior to COVID-19, we can only see the vaccines that were given by the health department. To be able to see any vaccines given by anyone in the entire county, it has to be based on zip codes. So we have to trust that the data was entered correctly. And for that, the state have to write a code, manually a code, that will give us access to draw that data from other providers. When someone enter the vaccine lot number for a case, they enter that Spanish character into the system because the code reads everything, including the vaccine's lot number. It got confused because it's a code in English. So it really didn't recognize the character, and it went crazy for those 2 days. So that's why we only can see the data, but we don't know what we don't know. We are assuming that normally we do about 10,000 vaccinations a day. We are assuming that we are losing about 20,000 cases in those 2 days. But we will have access to the data soon. They are rewriting the code, they have to rerun it, clean it, but we will have that data, I hope, by the beginning of next week.
This is Nikki Zizazo with News 6. My question's for Dr. Pino. Dr. Pino, you mentioned that the convention center site is going to be shutting down in less than a month. But at the same time, there's this push to get, more young people vaccinated, and that has been such a great tool to so many people in terms of a mass vaccination site. So what is the alternative to all the young people that may have been looking to that site as an option?
So closing the site doesn't mean that we are going to give up the number of vaccines that we offer daily there. So we are looking to keep up with that volume. We are working with the county and identify what a strategy is best for the county to continue to do that vaccination. We have advised that it will be best in this phase of the vaccines effort to have 2 sites in 2 different locations of the county that are doing 2,000 each or about 2,000 each, so that this is just an example, let's say west and east, so that we can cover different areas of the county. And you heard that the mayor, that the county itself, meaning without our help in resources or personnel, is moving into addressing some of the health inequalities that we have in our communities. So we are identifying areas, identifying locations, and we are going through the process. But what I can assure you is that we will try to keep the same volume or higher if we get more doses of the vaccines that we are providing at the site. So we are moving, probably the word should not be used shutting down the site. We are just moving to a different strategy as we move in our vaccination efforts. Something that we have noticed, it's interesting, when the population age change, the habits of that group change. So when we were doing the olders, we had a line there at 6:30 older people tend to arrive earlier. Then you tell them to arrive. With the younger people, we are at 7 looking and we have no one waiting in line. Everyone's arrived at 8 o'clock or later. So there are things that are happening and we have to adapt to the changing dynamic of the population and the vaccination itself.
Hi, this is for Dr. Pino. Sorry, it's Samantha Sosa from Fox 35. Reports out of the UK today say a study shows that over there they'll reach herd immunity by Monday, like this coming Monday. Does Orange County have any modeling similar to that? And can you talk to me a little bit about herd immunity and if there is a threshold to reach that?
So herd immunity is calculated differently for each disease because it has to do also with the rate on which this disease transmits. This is a disease that transmits very fast, so it requires a higher level of herd immunity. And I believe, and Dr. Prince is here, he could correct me, I believe the UK is just doing 1 dose first, is that right? So the UK took the strategy of doing 1 dose first for the entire population. That's why they are achieving it so fast. But they will have to go and do the 2nd dose at some point, depending on the type of vaccination that they received. When we were talking to Dr. Fauci, thanks to Representative Demings, that was our question actually, why we decided to go with that strategy and not the strategy that the UK has had. His response, which makes sense, is because we have acquired enough vaccination that we can vaccinate the entire population with 2 doses and even more because we are talking about some vaccine diplomacy at the federal level. So that's why they are arriving so fast to that number, and we are a little behind because we are doing 2. And every time that you're doing 2, let's say 4,000 that we are doing, half of that is the 1st dose and half of that is the 2nd dose. And it will continue to be like that for a while.
Eric Mock, Spectrum News 13. Question not for Dr. Pino, for Phil Diamond. Want to talk about, you talk about how, we're drawn out of the reserves still, but the collections are starting to go up, but how we've already drawn out more than $100 million out of the reserves. I mean, is there any concern, or do you think we'll be able to make up the collections in time to avoid any kind of budget shortfalls or anything like that? What's the outlook on the reserves and the tax collection?
Well, I think it's going to depend on collections going forward for the main part. One thing is we've gotten a lot of our bigger expenditures that we had to make. We've made them. We had to pay a substantial amount for the project at the Camping World Stadium. That's done. We had a couple of other big expenditures we had to make. Those are done. By the same token, one of the reasons that the drawdown last month was lower was because in December, the collections were higher. And if you get to the point that we're not too far from, we can hopefully stop drawing down collections. And it depends also on some other things. It depends on the convention center. A few months ago, they had some pretty substantial projects they were doing out there. And that's really slowed down a lot. And by the same token, when you talk to Mark Tester over at the convention center, he'll tell you they've got shows lined up. So the more shows they have, the more revenue they bring in. And that is something that, if they don't bring in shows and you're paying expenses to maintain the convention center, that's really going to be a big impact on reserves. So hopefully they have shows, people pay revenue, and you've got money coming in and you're not having to subsidize the convention center as much. So with those things, if those all keep in the same direction, things should be good. And, we do have about $80 million in a bond reserve account. That would pay a year's worth of debt payments. On top of that, we've got 60 or so million in another reserve account, and we've got somewhere around $50 million in a third reserve account. So we've had healthy reserves from the get-go, and that's something that we've tried to maintain. It's preserved our bond ratings, so our bond ratings have not been changed since the pandemic. So it's something where we started from a good position, and I think, and hopefully we will end up in a good position.
Okay, that is the end of the Q&A portion. Let me get my notes to do the introductions. All right, so as you all know, that you've heard today that we have seen the largest increase in our numbers within the 18 to 25-year-old group. And so what we have done today is try to make certain that we put a focus on encouraging that demographic to get vaccinated. So we have 4 students here to get their COVID-19 vaccine, and their goal is to really show support for what we're trying to do here in the community. So I'm pleased to welcome the first person. When I call your name and say a little bit about you, would you just stand at first? First, we have Ms. Samaya Butler at Rollins College. She's a junior who is majoring in psychology and minoring in sociology and global health. Samaya is a Dr. Phillips High School graduate and cares deeply about the health and wellness in our community. The second person is Ms. Meg Hall, who is a UCF junior who is majoring in legal studies. She is incoming SGA president. Meg says that she cares about keeping the UCF campus a safe and welcoming place for incoming students, and that's why she wants all students to get the vaccine. Next is Ms. Esther Percival, who is a student at Valencia College who plans to major in chemical engineering. Esther served on my COVID-19 Economic Recovery Task Force. She is getting the vaccine to protect the most vulnerable in the population, like her grandmother, and to show that we all need to help to get to herd immunity. And finally, Mr. Jack Cottarella is a senior at Winter Park High School and serves as president of the National Honor Society and captain of the boys' varsity basketball team. He is very active in registering students to vote, and he is equally passionate about this issue. So I commend all of these students for setting a good example and for making time and taking time out of their busy schedules to be here with us today. And so we have from the Department of Health, Medical Director Dr. Thomas Prince here to administer the vaccine, and his staff will join him in that process. So we're going to, Dr. Prince, I believe, bring up a couple of the students at a time to be vaccinated. So we'll go with the front row. Please come forward. Okay, and Dr. Prince is joined by Miss Tammy Gay, a nurse who's going to be assisting him in the process. All right, thank you for the first two. Now we will have the next two coming forward.
I want you to just hang on for a second.
Okay, Jack, please come up. And we're going to do a quick thumbs up.
Good, everybody getting tight, you're vaccinated now. Doc, you're in the excellent thumbs. Thank you. Good.
Let's say thanks to our students for being here. Thank you. And by the way, they all received Johnson & Johnson, so they're one and done. Thank you for joining us today. Let me say thank you to Dr. Prince and to Nurse Gay for joining us as well. It looked painless to me. And so thank you to all of you. Our next